162 cases. We're also reporting an additional 69 deaths, unfortunately, since our last update on Thursday. The 7-day average for deaths has increased by 7% over the last week to 15 deaths per day. Today, there were 1,161 hospitals in Ontario, and that's up from 1,090 last Tuesday. The number of people in ICU today is 510, which is up from 387 1 week ago. With respect to testing, today we're reporting 37,541 tests have been completed, with a percent positivity of 8.9%. This is the first time since January 6th that our percent positivity is above 8%. The average percent positivity in the last 7 days is 6.1%, and that's up from 4.7% for the same time period last week. Today, we're reporting a total of 2,342 confirmed variants of concern in Ontario. Of those, 2,165 are the B117 variant, which was originally identified in the United Kingdom. 71 are the B1351 variant, and 106 are the P1 variant originally identified in Brazil. We have an additional just over 27,000 cases that have a mutation detected. The weekly percent positivity for cases tested for mutations or for VOCs, variants of concern, today is 63.3%, and that is up from 61.5% just 1 week ago. As noted in the modeling that was presented by Dr. Brown last week, and as we have just seen in our most recent numbers, the trends in Ontario are worsening. The provincial cases rate is increasing significantly, as is the percent test positivity and the percent positivity for variants of concern. Hospitalizations are increasing rapidly, and ICU occupancy is increasing rapidly. We now have the highest number of patients in ICU since the beginning of the pandemic, and this is posing significant risk to our healthcare system. While great progress is being made with immunization, over 2.6 million doses have been administered to Ontarians, with 76,199 yesterday alone. More vaccines and more time are required before this will have the desired impact of lowering illness and death. I would now invite Dr. Williams to make some additional comments.
Okay, so thank you, Dr. Yaffe. And as you noted, the trends we're seeing as troubling. And on our federal, provincial, territorial meetings, that trend is all sectors are looking at that and are concerned, some more than others, especially in the western part of Canada. And each ones are dealing with the impact of variants of concerns within their respective jurisdictions. And of course, the impacts on their various healthcare systems and other congregate settings. Our concern mostly is the number of individuals in the hospital. And while our numbers, as was interesting that you noted over the long weekend, all around 3,000 each day, where we expect them to be increasing at a fairly steady rate, almost doubling over that period of time. While we didn't see that, we have to understand it was a long weekend, and the volumes of testing were down. The percent positivity went up accordingly, as we said, 8.9%. So we'll have to see how we fare this coming few days as the number of volumes of tests will go up, and we'll see what happens with the percent positivity, that we may be heading up into the mid 3,000 range and hopefully not progressing too rapidly up to 4,000. as we are trying to take steps to see what we can do to constrain this growth, especially in our younger age groups, which are presenting to the ICUs, or in the hospitals, I should say, first of all, in the emergency departments, in some parts of the GTA, in increasing numbers, and coming in with more severe cases from the outset, requiring immediate access into the intensive care units. And of course, this is putting a strain on our healthcare system. A number of critical transfers out of there to other hospitals to try and keep the numbers under control. So we have this challenge that's right in front of us, and what are we going to do to constrain the growth of these variants of concern, the number of people presenting there? As Dr. Yaffe said, we are moving as quickly as we can with our vaccination program, having received a volume of vaccines, and they are going out as we speak, out and around, and more are taking place. And we may even see this week a day of over 100,000 vaccines being given in one day. That would be a great achievement, and to obtain that number. Nevertheless, as Dr. Yaffe said, we need time. We need to buy some time to get the vaccines out, to get an effective number in our at-risk populations, and to try and see how that will impact, because it has to be in the arms, and it needs at least, for most, 2 to 3 weeks to start to give adequate immune level competency. So we have been looking at, we put in the province on Saturday, the so-called shutdown restrictions that we're trying to address there to make it across the province. Those are province-wide, to avoid movement from areas of high risk to low risk, so that there was equity around the province. And we have implemented those steps in there, as well as limitations on aspects such as indoor and outdoor dining. In there, we've had encouraged for outdoor activities, and we had watched that. Sometimes some people did it judiciously, others did it to large public places, which became counterproductive in that, and we're worried about that, as well as some other activities related to retail that were of concern raised to our attention over the weekend. I have had discussions with the medical officers of health from Toronto, Peel, and electronically with Ottawa, in exchanges with Dr. Davila, Dr. Lowe, and Dr. Etches about the issues they're facing, and of course to take their suggestions, as I said, and we've taken those to our public health measures table, who are putting together recommendations that I would then hope to take to the Minister of Health shortly, to get some aspects to take what further restrictions we need to put in place to ensure that and to bring down our numbers, not only for keeping the hospital numbers down, but is concerning that all three, while having concerns, and another medical officer of health about the impact on their schools, the number of students arriving positive, the number of staff sometimes arriving positive as well, that has started to overwhelm their case contact management in the respective jurisdictions of Wellington, Dufferin, Guelph, Peel, and most recently Toronto, that they're asking to have virtual learning already in Peel commencing as of today, and Toronto and Wellington, Dufferin, Guelph health units as of tomorrow, up until the end of the April break week, and then with hope of curtailing that and getting under control, and then resuming class attendance at that time. Their strong point was that they do strongly say that school opening is critical and important, that schools are safe. It's just that with their case contact system being overwhelmed with the number of people presenting, they were not sure they could say that all the schools in their jurisdiction were safe, and needed to have this break, if you may, in that, and hopefully bring those numbers down and put them back in control, seeking to open schools back up again on the 19th of April. So our overall message is that with a variance of concern especially, those who thought in the first wave and second wave, we heard this through our surveys, that said some had got it, it wasn't a big deal. Some said second wave wasn't a big deal. In this third wave, it is a big deal. And some who thought they weren't having a problem are suddenly becoming quite ill, having to present to emergency department urgently and get into the ICU. And I'm hopeful that the care will be able to be sustained, and to be able to avoid mortality related to it. But it is a serious issue that everybody has to take seriously at this time. And these restrictions and precautions, no matter what area of the province you're in your activities within the household, staying close to home, not traveling around the province, we have to be really careful in this at the moment before our ICU have to take more stringent actions accordingly. So these are serious times to be taken seriously. Keep going out if you're going to need to be vaccinated. Essential aspects only. Do so with much precaution around personal protection with masking, distancing. If you're ill, stay home and get assessed and get tested. And stay within your household, both inside and when you're outside with any activity, just with your household or by yourself if you're doing your exercise or walking your dog, etc. So strict times require strict actions and really attention to all these right at this time. I can't overemphasize this at this moment. So with that, I'm going to turn it over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Anthony Fury, Post Media. Please go ahead.
Hi there, Dr. Williams. Thank you for taking my question. It's about the schools issue. I know a lot of people mistakenly believe that the number of cases in schools reported daily means the number of cases acquired in schools. And you have in the past clarified multiple times that actually when it comes to in-class transmission, there's hardly been any at all throughout the province. But I know some people now are asking and theorizing that has this changed with the new variant? So can you update us on in-class transmission throughout Ontario? Has it in fact gone up considerably?
So thank you for that question. It's a very good point to clarify. A lot of the cases we're seeing at schools is where one symptom testing have come and been identified and are getting tested before they get in the classroom. They may have been in the classroom a day or two before, and then those cohorts, that classroom, including the teacher and the children, are then put into a self-isolation status at home, usually getting tested, but required to stay out for the 2 weeks until any possibility of incubation. We have seen very few go on in those groups to have developed signs and symptoms and positivity of testing. As well as the Ministry of Education has undertaken a number of whole school testing surveys and have found the positivity to be less than 1%. So our message still is that in school is safe. The issue around that I was alluding to, where you've heard from Toronto and Peel especially at this time, that they have found that in some schools they were concerned there might have been some transmission, but their case contact management was starting to get overwhelmed with all the contacts to follow. So therefore they have asked for a pause at this moment for the short week and April break to get reorganized on that and to put in steps in place to ensure the ongoing safety, so that while they couldn't say there wasn't any transmission, there was some small cases of it. And then Toronto had a couple of schools where they felt there was some small, but not many out of the hundreds of schools that are even in Toronto and Peel that they had seen that. So by far, the safety of the schools has been maintained. What they're attempting to do by their temporary closure for a few days is to continue that and to ensure their safety when they reopen again on the 19th.
Follow-up?
Okay, great. Thank you for that. One other question, again, a sort of clarification. You were referencing earlier younger age groups presenting to the ICUs, and we've heard that a lot. And I think there's some confusion as to just how younger you mean, because earlier today, government officials talking about expanding access to the vaccine, dropping it to age 50, because it's just 50 and over where there's the high-risk category. So when you say younger age groups in ICUs, do you mean people in their 30s and 20s, or do you mean just, younger than 70, people in their 50s and so forth?
Okay, so I can start. Maybe Dr. Yaffe has a comment. We are modeling last week with Dr. Brown. As you notice, his data up until the end of March, he was showing that in the past, the ICU demographic of those presenting there prior was 25% were under the age of 60. He noted that in this week of the last week of March, that had shifted so that 46% of the people were under the age of 60. That still means 54% of the people are over the age of 60. And that concerns me greatly because that in that group, remember, we've already vaccinated 80% of the over 80s and a good part of the over 75s at that time of the report, and even further now. That means that cohort between 60 and 75 are making up 54% of our ICU admissions. And over the last few days, that's gone up considerably because we went from those numbers back then was in the low 400s. Now it's over 510. And so there have been reports from various intensivists noting that some in the ages of the 50s, definitely, and 40s. There have been some 30-year-olds, but hopefully not below that too much. I wouldn't rule it out, but most of them are in the age group, as I said, still at the moment 60 to 75, but now we're getting a lot more, especially 40 to 60 coming in, and coming in quite ill. I don't know, Dr. Yaffe, if you have any comments you'd like to make on that.
Yes, certainly we have had, anecdotal reports even of people in their early 20s in the ICU. And the numbers of cases in general in the 30 to 49-year age group is going up. And certainly I was looking at the information on the most recent 8 deaths of them. 2 of those people were under the age of 60. They were in their early to mid-50s. So the trend is certainly going toward younger, but still affecting the older as well.
Just a reminder to press star 1 if you have a question. If no one else joins, this will be the last question.
From Marie-Hélène Rattel, Radio-Canada.
Good afternoon. Premier Ford said in his news conference today that measures regarding the situation. I was wondering if you could tell us what are you going to recommend the government? What are you recommending the government? What can be the stricter measures put in place, considering that we already got into a new lockdown as of Saturday?
So, well, thank you for the question, and that's what we're doing right now, a combination of what we have in the shutdown. There are still some services that are open that some will feel might be encouraging higher mobility of our public out and around. Even some of the outdoor activities, it seemed unusual to me that people would go a long distance to go to a large park and congregate with 500 to 1,000 other people. That was not our intent to say do your activities outdoors. We wanted you to do your activities outdoors as a family or as an individual in groups smaller than 5, not in large crowds and congregate settings. So I know the Premier saw that as well and was concerned about some retail locations being crowded and was looking at that. And I know he commented on that in his press conference. So our public health measures table is taking recommendations, some of course provided also from the letter from Drs. Davila, Etches, and Lowe, but also we've had other emails from other MOHs around the province who have also weighed in with their recommendations and concerns also, and we have had some from the science table. And we've also had recommendations from my scientific advisor, that being Public Health Ontario, who have come forward with their recommendations. So all this is going forward to say, what more must we do to try and bring this over 500, which is worrisome enough, and especially if we can't curtail it to keep it down under 600 or even further, we're going to have to take more strident measures. We don't want to do that. We don't want to close our schools anymore. We need to keep those down. As I said, if those community numbers keep going up, that threatens both our healthcare system as well as our school system as well, and neither of them we want threatened because people are being less than careful in their personal activities in their respective jurisdictions. So we'll be looking at some recommendations to give to the Minister Elliott and to, if further to the Premier when he requests that.
Follow-up?
One of the experts from Sunnybrook Hospital told us today on air that this is the worst situation Ontario has ever seen since the beginning of the pandemic. So therefore, there is a need for stricter measures in place. Have you considered something like a curfew that has shown to be efficient, he was saying, in Quebec, for example?
All those aspects are on the table to be looked at, comparing with other jurisdictions of what works and how have they worked. So that's part of the scientific. I think it is the worst. I mean, the numbers in the ICU is more than we had in the first and second wave at one time, and they're seeing the severity of the cases, even though our numbers equivalent should be around 4,000 to 5,000 new cases a day. Those smaller numbers, we should not take comfort in the fact we're only sitting around 3,000 because a higher percentage of those people are showing up in the emergency department quite acutely ill and requiring ICU beds right away and demanding a huge load on our intensive care teams and staffing. So It is the worst it's been in that way, and we have built more reserve for capacity, but that capacity has been quickly eroded because we have to ensure the safety and the ongoing capacity of our human health resources as well as our facilities in there. So until vaccination catches up, which is not for a while yet, we still got to get some more out there to make enough of a capacity to impact the overall aspects. We have to do with the public health measures, and we have to do whatever we can, and so the public can do whatever you can to be very vigilant and careful in the next 3 to 4 weeks so we can bring this back down again and allow vaccines to catch up and bring the whole pandemic down as we look forward to. It's a race against time, and everybody has to stay focused on the task for the next 3 to 4 weeks especially.
Next question.
From Randy, CHCH TV.
Yeah, hi, Dr. Yaffe. A couple of weeks ago, I asked you about vaccinating migrant farm workers when they came into the country, and you told me that you were negotiating with the federal government to have them do it, and that if they weren't going to do it, that the province likely would. Is the province vaccinating migrant farm workers at the airport?
Yeah, thanks. The update on the situation that I've received actually just this morning is we're working to, I think, start with a pilot potentially later this week to vaccinate the farm workers at the airport. Obviously, we want to start as soon as possible because they're coming in already.
Follow-up?
How high a priority is that? Just in relative terms.
Well, our vaccination program has sort of two different categories of priority. One is age, and the other is people who are at risk, increased risk. And so temporary foreign workers do fall into the second category. And they are at increased risk because of the settings that they're going into. And so we want to make sure we get them vaccinated before they go there and make sure that they're as protected as possible. So they are in that category.
Last question.
From Travis Van Raj at Global News.
Hi there, doctors. Thanks for taking my question. My first question is for a colleague of mine, Matthew Bingley. He asked, virtual concerts aren't allowed during the shutdown. Venues say they put in safety measures and would like to know why they're being targeted while film studios are allowed to carry on indoors. Why are they singled out while film studios
Well, the main difference there between the two is that the film studio business has been very strict in their investment of testing and protocols and restriction of people on the set, including limiting their activities off set in there. So it is ongoing endeavor, whereas the one with the virtual arts is sometimes very much put together on that time and the number of people on the stage at the same moment, sometimes in very close proximity. So the same type of protective investments, which does cost money, has not been in place in the latter, but the film industry has put that in place and has maintained that throughout this time.
Follow-up, and this is the last question.
Okay, thank you for that, Doctor. And the second question is related to the letter that was sent to you yesterday, I believe, from 3 medical officers of health, Dr. Lowe, Dr. Davila, and Dr. Etches. And they are urging you to put into place a stay-at-home order along with other stronger measures. Will you do that? And if you can't say whether or not that is the case now, why not? Because there's always this teasing of announcements the next day or in a couple of days. So will you put in place a stay-at-home order?
So, as I said earlier, I did get the letter. I did have conversations actually with Doctors Lowe and Davila. I have emails back and forth from Dr. Etches, and then we have asked our public health measures table to take those, including other recommendations similar from other medical officers of health in the province of Ontario, as well as our science table and from Public Health Ontario. And we hope to have those recommendations to take forward soon. In that to the Minister of Health, because you may say, well, the time and limits there. some of those things like the stay-at-home order involves a lot of regulation and legislation. So these things have to be walked through with due diligence as far as any other aspects that might impact that. So if you're going to do it, you have to do it right. So while we do make recommendations to enable that and to have it to occur, requires due process within government structures to enact those and to carry out their implementation.
Thanks, everyone.